Now let's examine some common diagnostic tests used to identify problems. The physical therapist must be familiar with and understand the results and implications of these special diagnostic tests to help guide treatment, and this knowledge also enables the physical therapist to respond appropriately to patient questions. With respect to CAT scans and MRIs, these diagnostic tests have revolutionized diagnostic capabilities. These tests result in cross-sectional, three-dimensional images of internal structures, such as the brain or spinal cord. First, let's look at computerized axial tomography, or a CAT scan. This employs computer synthesis of X-rays transmitted through a specific plane of the body and results in three-dimensional images. Here is an example of a CAT scan image. This image shows a cross-sectional slice of the abdomen. To understand the anatomy in this image, visualize the patient lying on their back. You are standing at the foot of the bed, looking towards the patient's head. Major anatomical structures are labeled, and a tumor is visible in the head of the pancreas, as indicated by the arrow, as seen right here. This type of imaging has revolutionized diagnostic testing. Magnetic resonance imaging, or MRI, also results in three-dimensional images using computer synthesis. However, in this case, instead of using X-rays to obtain an image, the body part is placed in a magnetic field, and this is how the image is obtained. In this slide, you can see an MRI image of the brain. See the remarkable detail that's available for diagnosing. Angiography is a diagnostic test used to visualize occlusions, aneurysms, and vascular malformations. Radiopaque dye is injected into the body, and then imaging techniques are employed to visualize the blood vessels. In this slide, you see an occlusion of a blood vessel as depicted here. Lumbar puncture is a diagnostic test that can be used for various purposes. One is to measure intracranial pressure, and this is the pressure in your central nervous system. Another would be to inject radiopaque dye for a myelograph. This is similar to angiography, only in this case we are looking for nerve impingements. On the slide you see an image of a myelograph. This would be a normal myelograph, and here we see impingement of nerves. And finally, lumbar puncture can be used to obtain a sample of cerebral spinal fluid, and this is done to look for infectious organisms. Diagnostic tests depicted in this slide from top to bottom include electroencephalography, electromyography, and nerve conduction velocity. In the case of encephalography, or EEG, which of course is much easier to say, this is a test that measures electrical potential or activity in the brain. And you can see the placement of electrodes right here in this slide. Electromyography, or EMG, is depicted here. And this measures electrical activity in skeletal muscle at rest and with voluntary movement. And finally, we have nerve conduction velocity depicted here. This measures the rate of electrical transmission along peripheral nerves. This is useful in diagnosing nerve entrapment conditions, for example, as this test will show where the nerve conduction is slowed. Nerve conduction velocity tests can be performed by physical therapists that have specialty training. Now let's look at physical therapy evaluation of the neurologic patient. The goal of physical therapy for all patients is to improve and/or maintain functional movement and prevent decline. As with any patient type, prior to the physical therapy examination with the neuromuscular patient, all pertinent medical records must be reviewed. This provides information regarding pertinent medical history and what diagnostic testing may have occurred. The subjective exam, again, includes the interview of the patient and/or family member, asking about the patient's condition, and also gives the patient and/or family an opportunity to voice concerns and hopes. We covered the typical questions asked in such an examination with the orthopedic patient evaluation previously. However, with some types of neuromuscular conditions, as we have learned, cognitive problems may also be present. So in addition to the typical questioning about pain and function, questions regarding cognition are also vital. These include questions regarding orientation, attentiveness, short-term memory, and judgment. So, for example, to determine a patient's level of orientation, questions are asked about person, place, and time. Questions such as, can you tell me your name? Do you know where you are? Do you know the date? Do you know what time it is? These types of questions are asked to determine how well a patient is oriented. In addition, attentiveness, short-term memory, and judgment are also examined with a combination of questions during the subjective exam and observations during the objective exam. Communication disorders are also present with some neuromuscular conditions. Previously, we discussed aphasia, both receptive aphasia and expressive aphasia. Communication disorders such as these can be discerned with questions and observations. Deficits in cognitive functioning, as one might expect, can have a major impact on the patient's ability to function. The physical therapist must perform a thorough subjective and objective exam regarding cognitive deficits to plan a program for maximum effect. For example, in the case of a patient suffering from receptive aphasia, demonstration of activities will be more effective than verbal description. Now let's look at the objective physical therapy evaluation of the neurological patient. Objective examination for the neurological patient includes many of the same techniques already covered in our discussion of the orthopedic patient. For example, functional activities, or ADLs, are examined. This includes bed mobility, transfers, and ambulation. In short, the ability to assume and maintain a posture and to function in different positions and environmental conditions. Typically, this kind of evaluation is more extensive with the neurologically impaired patient, as they have more deficits regarding these issues than the typical orthopedic patient. In this slide, you see a man with left hemiparesis ambulating with an assistive device, right here. This is an example of ADL examination and training. Two additional areas not typically assessed with the orthopedic patient, but common in a neurological patient examination, are motor control and muscle tone. Motor control refers to one's ability to produce voluntary motion, to be able to isolate motions, stop and start motions, and control the speed and range of movement voluntarily. An example is the ability to grasp a coffee cup and take a drink. This requires the ability to voluntarily control the motions at the hand, elbow, and shoulder. With some neurological conditions, patients are unable to do this. Instead, they may have uncoordinated motions with little fine motor control or ability to isolate motions. These are referred to as synergistic involuntary movements. Here you see an example of a synergistic involuntary movement as this woman attempts to pick up dominoes. As you can see, she has difficulty grasping the object and her shoulder and elbow motions are uncoordinated. Watch as her elbow bends, her shoulder elevates. Now let's discuss muscle tone. In the case of muscle tone examination with the neurologic patient, we are examining for the presence or absence of normal muscle tone. Muscle tone is defined as the tension exerted and/or maintained by muscles at rest and during movement. Healthy muscles are never fully relaxed. They retain a certain amount of tension and stiffness or muscle tone that can be felt as resistance to movement, referred to as normal muscle tone. Abnormal muscle tone may be a result of neurological injury. Hypotonia, sometimes referred to as spasticity, is an abnormal muscle tone marked by an abnormal increase in muscle tension and a reduced ability of a muscle to stretch. It is caused by injury to motor pathways in the central nervous system, which carry information from the central nervous system to the muscles and control posture, muscle tone, and reflexes. Hypotonia, on the other hand, is abnormal muscle tone marked by decreased muscle tone and strength, a sort of a floppiness, for lack of a better term. This is commonly found in conditions like cerebral palsy and cerebral vascular accident. Not only does hypotonia result in deficits in function, it can also lead to subluxations and dislocations at joints. One common dislocation is at the shoulder joint following cerebral vascular accident in the presence of low tone. Also included in the physical therapy evaluation of the neurological patient are sensation and perception testing. Sensation and perception are essential for normal movement. Assessment of visual, vestibular, tactile, and proprioceptive abilities are essential in identifying deficits and guiding treatment for the neurologically involved patient. For example, individuals with loss of proprioception need specific training to regain this sense. Proprioceptive nerve endings are found in the joints of the body and send information to the brain concerning joint angle and movement. Along with visual, vestibular, and tactile information, proprioceptive information contributes to the sense of position of self and movement. Damage to this system can severely impact movement capabilities. Also on the slide you see other examples of sensation and perception testing. In the upper picture you see someone testing light touch capability. In the lower example you see a woman with her hands through a device picking up certain objects and matching them to pictures that she is looking at. This test examines her ability to integrate sensory information. In other words, can she feel the objects in her hand, integrate that sensory information, and discern the correct object? And finally, flexibility is often examined with neurological patients, as decreases in flexibility can impact one's functional movements and increase energy expenditures with movement. Improving flexibility at joints, then, can facilitate improved movement and improved efficiency with movement. So in closing, then, we have examined common neuromuscular conditions encountered in physical therapy, and we have looked at common examination methods for the neurological patient.